Welcome to our online health talk organized by Elder Love and Missi Care through our online education platform, Missi Edu. 2021 has been a very challenging year for everyone. Despite that, we still managed to hold a few online health talk, and we sincerely hope that it benefit most of us and all the audience. And today's talk on what is vaccination is going to be the last of the series for 2021. For 2022, we'll have a whole new series of health talk and hope everyone will continue to support us and stay tuned for more topics coming up. Now, let's get back to our talk today. What is vaccination? Always a lot of people think that immunization and vaccination is almost the same thing, which is true, but there are some subtle differences. Like vaccination is the nursing procedure that injecting the vaccine to produce immunity towards a specific disease or infection. Whereas immunization is become immune to specific infection or disease, and typically through the process of vaccination. Now, vaccination saves life. And after clean water, vaccination is the most effective public health intervention in the world. And it's vital that everyone eligible get vaccinated. So it's second most important after clean water. So what actually is vaccine? It's a substance that teach our body immune system to recognize and to protect against a disease caused by this infection agent, like for example, a virus or bacteria. Let's have a glance at the development history of vaccine. Way back in 18th century, as early as 1998, Edward Jenner coined this idea of a vaccine and vaccination. During that time, smallpox had been very rampant at that time, and because of that, they developed the first vaccine against smallpox in 1800. And subsequently, Louis Pasteur started a live vaccine, start developing a live vaccine. Subsequently, we have a Spanish flu pandemic in 1918, which killed about 20 to 50 millions of population worldwide. That triggered off the development of a more vaccine, and including the Spanish flu vaccine. And subsequently, the development of the various vaccine speed up. And come to 1950s, polio become very virulent and become very rampant whole world and in particular US. And because of that, from the technology they learned, they developed the first polio vaccine in 1955. In 1980, smallpox was eradicated thanks to the vaccination program. And subsequently, following years, we have many vaccines that work miracles. For example, measles and rubella are longer endemic in US in year of 2000s. And we have the outbreak of influenza H1N1 in 2009. And because of the technology that we have learned, we managed to come up with a very effective vaccine, and we managed to contain the disease very fast. And recently, with the COVID-19 pandemic in 2020, so we have a various vaccine available now, and you can see the effect of vaccine actually save life and prevent ourselves from getting the severe diseases as well. So we can conclude that vaccines are very important because it will not only prevent us from getting the disease, but also prevent us getting sick and even death. So it will achieve a herd immunity eventually. So a few facts on the vaccine. A lot of children die every year, 100,000 whole world because of this preventable disease through vaccine. In particular, all the infection, like for example, Haemophilus influenza, pertussis, measles, tetanus, pneumococcal infection in the lungs, and rotavirus that cause gastroenteritis and diarrhea. And you can see that 100,000 that children die because of that. And all this happen mainly on unvaccinated children and happen in an underdeveloped country. And if we can segregate and distribute the vaccine equally and let these poor children have access to the vaccine, we not only can save billions of dollars, but also we can save 25 million lives across the world. Not only that, Vaccine have proven eradicate disease, like for example smallpox. And so as polio, we are hoping that we will achieve eradication of polio soon. Now, how does a vaccine work? It's very simple. A patient or a population, a person is given a small amount of the harmless form of the disease, for example, part of the virus or bacteria. Then the body will make antibody to fight against it. And the body will have this memory to produce this antibody again should we encounter the disease again. So the antibody come out and kill all the virus or the bacteria. So called we are immune. Now there are various type of vaccine, how the vaccine are developed. Just a few examples of the vaccine available in the market. The first one is inactivated. The whole organism, microorganism like virus or bacteria is destroyed either by heat or chemical radiation, and then they're inoculated into our body to generate antibody production. As example of this inactivated vaccine are influenza, cholera, and polio vaccine. Certain vaccine is developed through attenuated. That means the live microorganism is modified to become less deadly or closely related microorganism that induce immunity inoculated into our body. Example of these attenuated vaccines are measles, rubella, mumps, even tuberculosis as well. Now, certain bacteria cause disease through the toxin that they produce. So this toxin can be very harmful to us, for example, in tetanus and diphtheria. And scientists develop antibody against this toxin. We call it inactivated toxin compound that inoculated in the body to induce antibody against them. So that next time when our body exposed to this toxin, we are protected and immune. Now, certain vaccines developed through the part of the virus, like for example, hepatitis B and human papilloma virus, HPV. We use part of it, like for example, the DNA part, and inject into the body to induce antibody production. Now, some vaccine through conjugate means that the joint combine part of the bacteria or the virus combined with other part of the virus to induce more antibody production. Type, for example, in the Haemophilus influenza is very typical of this conjugate vaccine. There are certain types like heterotypic means that the pathogen or the microorganism that affect animals but do not cause harm to us, they were injected into our body. Now, tuberculosis is typical, they call it BCG vaccination. Actually, they're using the Mycobacterium bovis, is a milder form that's harmless to the human body, and they make it weaker and inject into our body. This is a typical vaccination program, immunization program in Malaysia. Upon birth, all the newborn will be vaccinated with a BCG, hepatitis B. And subsequently, the following months, you have a hepatitis B until month 6. Then 2, 3, and 5th month, they will receive polio vaccine and DPT vaccine as well. And subsequently, they're supposed to receive measles and mumps rubella as well. And of course, the new development of better and newer vaccine, they have the jadual imunisasi tambahan, where the children will get vaccine for rotavirus, pneumococcal, influenza, meningococcal. Meningococcal is the bacteria that cause brain infection. And some will have hepatitis A, and varicella is a chickenpox vaccine. Now we talk about the vaccine. Of course, we have to talk about the COVID-19 vaccine, which is a very hot topic since early this year and even now because of the booster dose. There are basically 4 types of COVID-19 vaccine, but commonly in Malaysia, we heard a lot about 2 to 3 types only. The first one is live attenuated, which we don't hear a lot in Malaysia. Inactivated type, subunit, and using the RNA of the virus. Now, the genetic vaccine, the common one used now, one of the good example is a Pfizer or BioNTech or Moderna. They use the RNA to induce the antibody response in our body. And this is typical of the new type of vaccine development. Inactivated vaccine, some of the example of inactivated vaccines are Sinovac and Sinopharm, where they kill the virus and inject into the body. That will hope that will trigger off the immune response, and so that next time when we expose to the COVID-19 virus, our body will generate this antibody and kill those virus. The other type is a viral vector vaccine. Example of the viral vector vaccines are from the AZ, AstraZeneca, CanSino, and Janssen. Actually, they use the unrelated harmless virus. Like, for example, in AZ, they're using the adenovirus. CanSino, they're also using the adenovirus. AZ, they use a chimpanzee adenovirus, whereas CanSino use a human adenovirus. And this vector will carry part of the genetic material from this COVID-19 virus. When this vaccine injected to us, our body will use this genetic material and produce part of the protein from COVID-19 to induce antibody production. Some are using part of the protein, just a small fragment of the protein in the virus to induce immune response. This is something like the hepatitis B vaccine. And we don't see it in Malaysia. Example of it is Novavax. And the alternated one is something like the polio vaccine. They use a weakened virus to inject into the body. So conclusion, vaccines are safe and effective. Because any licensed vaccines have been vigorously tested before it's approved for use, and they have always continuous surveillance of the effectiveness and any other side effect. Vaccine prevent deadly illnesses and proven again and again over centuries that vaccine actually save life. Vaccine provide better immunity than natural infection because natural infection, it can be fatal and cause long-term damage, whereas vaccine is in a controlled method of immunization, so it's much safer, and the immunity resulted from the certain vaccine can be lifelong. Combined vaccine are safe and beneficial. We have been using different types of combination, like for example, mumps, measles, rubella, we call it MMR. DPT, like for example, diphtheria, pertussis, and tetanus in one injection, and that induce a better protection to various organisms that it covers. And in fact, any ongoing school children or school-going children, they are exposed concurrently to various pathogens than the numbers that we are giving through vaccine. So combined vaccine is very safe. Now, if you stop vaccination, disease will return despite with better hygiene, sanitization, access to safe water. But if you don't continue with the immunization program, the disease may come back. Thank you for your time, and we'll see you again in 2022.